Uric acid is a waste product that is released in the body during various metabolic processes. Sometimes, uric acid builds up in the joints, kidneys, and other tissues, due to which you may develop a range of health issues, among which gout is the most prominent. Gout is characterized by intense attacks of joint pain. In some cases, joint pains and other symptoms of high uric acid levels remain subtle and go unnoticed. Patients came to know that they have a high uric acid level only when they develop severe attacks of joint pain due to gout. Hence, it is important to know those hidden or subtle signs of high uric acid so that you are able to detect this abnormality before it causes severe complications. Here are the 5 hidden symptoms of high uric acid that you need to watch out for so that you can seek appropriate measures before there is considerable damage to your joints. Number 1. Pain in the joints. When we talk about gout or high uric acid, the first thing that comes to our mind is sudden attacks of pain in the joints of the great toe. It is true that the abrupt onset of severe pain in the toe joints is the most common and often the first noticeable sign of gout. However, the absence of any such abruptly occurring joint pain should not be mistaken as having normal uric acid levels. The increase in uric acid levels that leads to gout does not occur suddenly, unlike the gout attacks that are known to strike suddenly at any time. The pain may also be mild or persistent, just like the joint pain caused due to rheumatoid arthritis or osteoarthritis. Also, the rise in uric acid levels basically occurs due to the abnormalities in the metabolic processes, often linked to the uric acid released in the body, to the extent the body cannot handle it efficiently. This means when you reach a point wherein your body no longer has the capacity to break down uric acid, it will start building up in the blood and forming crystals. These crystals often migrate to the joints, including the toe, causing pain, redness, and swelling. But the deposition of uric acid crystals, also called urate crystals, can also occur in other joints of the body. Hence, the pain may be felt in other joints of the body as well, such as your knees, wrists, ankles, and even elbows. When gout caused due to high uric acid levels shows up in multiple joints, it can become especially hard to diagnose. However, being aware of the hidden symptoms and the fact that high uric acid can also cause slowly progressive and mild to moderate pain in the joints other than the big toe is necessary to be able to not miss the diagnosis. Number 2. Fatigue and lack of energy. Gout is basically a metabolic disorder. The metabolism involves a large number of biochemical reactions that are interlinked. These biochemical reactions play a key role in releasing energy in the form of ATP molecules to help us perform our routine activities. Sometimes, a rise in uric acid level can occur due to metabolic dysfunctions involved in the process of energy production. This is more likely to occur in patients who have diabetes. In such cases, patients may experience unexplained fatigue or tiredness even during the daytime. They may also feel so worn out that they believe what they are having is viral fever like the flu. This kind of clinical presentation might mislead you further when you also experience other signs of the flu, such as a fever or muscle aches. While these symptoms are likely to be due to the flu, it is important not to ignore the possibility of having high uric acid, especially if you experience these signs repeatedly. Feeling too tired, excessive fatigue, and the feeling of being worn out can actually be the hidden signs of an underlying metabolic abnormality that can lead to or be the cause of a high uric acid level. If not detected and managed properly, it may worsen and trigger severe attacks of joint pain. Number 3. Strange bumps and lumps. If you notice strange bumps or lumps around your joints, it is best to get yourself tested to confirm or rule out the possibility of high uric acid levels in the blood. The lumps formed due to high uric acid and gout are called tophi. They are actually the mounds of urate crystals. These lumps often get formed over the skin of the joints. Surprisingly, tophi are very common in chronic gout patients, yet they often remain hidden and are left ignored, especially when the person does not experience severe attacks of joint pain. Tophi may also develop when gout is not properly treated. They can also occur when the underlying metabolic abnormalities persist or when the patients continue to follow incorrect dietary habits such as eating foods having a high purine content. Being aware of these hidden signs of high uric acid levels can not just help in the diagnosis of the condition, but also give you an idea of how well your treatments are working. Number 4. Blood in urine. Passing blood in urine can be a scary and disturbing experience. The presence of blood in urine is one of the most common yet lesser-known signs of high uric acid levels, perhaps because it is more commonly linked to kidney dysfunctions. The passing of blood in urine occurs when the buildup of uric acid in the body occurs to the extent the kidneys can no longer excrete them via urine. The high concentration of uric acid in the urine results in its accumulation in the kidney tissues in the form of one or more stones. The person may pass blood in urine when the kidneys try to push the stones down the urethra so that they can be eliminated from the body. The stones rub up against the walls of the urethra and cause damage to these delicate tissues while they are being pushed down, causing the trickling of blood. This is the reason why high uric acid levels may present with blood in the urine. It is often accompanied by severe pain in the abdomen, usually radiating from the back. The pain is more severe while passing urine. The development of these signs should alert a person about the possibility of having high uric acid so that he or she can get tested for the same to get an early diagnosis. Number 5. Backache. This is one of the most hidden and the least expected symptoms linked to high uric acid levels. Most patients believe they have spondylosis or arthritis when they have a mild or dull aching pain in the lower back without realizing it can be due to high uric acid as well. Back pain caused due to high uric acid can be traced to the formation of kidney stones. The kidneys are located in the abdomen closer to its posterior wall. The anatomical position of the kidneys is such that most often, the symptoms linked to the renal dysfunctions are felt in the back. This is why the formation of kidney stones due to the increase in uric acid levels often results in continuous or intermittent dull aching pain in the back. It is obviously accompanied by other signs of kidney stones such as blood in urine and pain while passing urine. The unique symptoms that can help to differentiate between the backache caused due to spinal and vertebral problems like spondylosis or due to kidney stones are its location and spread. The backache caused due to spinal or vertebra problems is often felt in the lower back region and may radiate to the legs, especially if the patient has developed sciatica. However, when backache is the sign of a high uric acid level and kidney stones, it is likely to radiate towards the front of the abdomen and pass down to the pelvic region. Being aware of these hidden characteristic signs will help you know why exactly you are having back pain and allow you to get the right diagnosis. The early detection of high uric acid levels based on these hidden signs will help you receive timely interventions aimed at bringing down the levels back to normal. Gout is commonly linked to pain in the joints of the great toe. In the absence of these obvious symptoms, it can become very difficult to know if your uric acid level is high. Being aware of the subtle or hidden signs of high uric acid levels will help you keep a closer watch on this metabolic abnormality. It will allow you to take steps before the uric acid levels become too high to cause intense and often unbearable episodes of gout or kidney stones. If you've enjoyed this video and it helped you to learn more about gout, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new life-saving video, you'll get notified right away. Till next time.